You are a woman with hair loss and you're wondering if you can use DHT blocker like men, finasteride or herbal substitute for finasteride. Let's find out. I'm Dr. Parsa Mohebi, the celebrity hair transplant surgeon. Let's find out if women can also use DHT blockers for hair loss. So I get this question all the time that women want to use finasteride, dutasteride, or saw palmetto, pumpkin seed oil, the stuff that are DHT blockers. These products are usually used for men who are having male pattern hair loss, and the way they work is they stop the conversion of testosterone to dihydrotestosterone, which is causing hair loss. But the question is, do women can use it, or do they ever need it? This is a tricky question because a certain group of women can use DHT blockers. Those are probably women who are in postmenopausal area. They can use DHT blocker because their female hormones drop and the little testosterone that they have in the system may act up and may cause hair loss. By using DHT blocker, even herbal version of DHT blocker, you can improve your hair. But women who are not postmenopausal and they're still having their periods, they may not need any DHT blockers because they don't have testosterone, or if they do, they have enough estrogen, progesterone that support their hair, so they won't lose hair because of DHT. Most of the time when we see women who have unrelated hair loss, unrelated to male pattern hair loss, or they are atypical, we ask for a set of lab works that we include testosterone and DHEA. These are two male hormones. So we want to get those checked, and if they are normal, we don't have to do anything else. Sometimes we see those are elevated. Obviously, we want to see why they're elevated. We're going to get to the cause of that. But at the same time, we want to stop the conversion of testosterone to dihydrotestosterone that is causing hair loss, and by doing that we can prevent further hair loss. So if you're losing hair and you are a woman, you need to be evaluated. You may need certain medications, but do not start taking DHT blockers without a physician's recommendation. I hope you'll learn whether women can use DHT blockers or not. If you have other questions or comments, put them in the comment section. And don't forget to follow us on social media.